I am Kenneth Tachie, a hepatologist, meaning that I am a doctor that treats diseases of the liver. Today we're going to be talking about why people develop liver cancers. Liver cancers are the 6th most common cancer in the world, but the 2nd deadliest. And the reason for this disparity is because many people who develop liver cancers do not survive. So 95% of people who develop liver cancers, unfortunately will die from the disease. The liver cancers occur more commonly in men than in women. Also in Africa, sub-Saharan Africa, and also in Ghana, liver cancers affect the younger people, so people below 50s, compared to liver cancers in other parts of the world that tend to affect elderly people. The reasons for these differences again are because of the causes or the differences in the causes of liver cancers. The commonest reason why people develop cancer is because they have developed damage to the liver, scarring of the liver, known as cirrhosis. And the reason for the cirrhosis is because of the many factors I shall tell you about. Commonly, hepatitis B, hepatitis C, excess alcohol consumption, excess fat around the liver, also known as non-alcoholic fatty liver disease, consumption of contaminated grains by a fungus that produces a toxin known as aflatoxin. Again, increasingly, liver cancers are being linked to diseases like obesity and diabetes. Now let me tell you about these individual factors that I have mentioned. Hepatitis B is the leading cause of liver cancer in the world. 70 to 80% of people who have liver cancer, it is because of hepatitis B. And the situation is very similar in Ghana. Majority of people who have liver cancers are also infected with chronic hepatitis B. The difficulty with hepatitis B is that most people are infected in childhood and it has no symptoms in adulthood until the damage to the liver has occurred, either cirrhosis or the cancer. And so again, we do not recognize this hepatitis B oftentimes until the cancer has occurred, meaning that we oftentimes diagnose hepatitis B only when the cancer has occurred, and often that is late. Hepatitis C is not as common as hepatitis B in Ghana, but it is still a problem. Again, it does not have a lot of symptoms in adulthood, infections earlier on in life, but again, over many years, it would lead on to cirrhosis that I mentioned earlier, and again, this becomes a major risk factor for developing liver cancer. Excess alcohol destroys many other things, including the liver. And once the liver is affected, again, if you don't stop the drinking, it goes on to develop cirrhosis. And once cirrhosis sets in, oftentimes the end result may be liver cancer. The other risk factor that is quite prominent in Ghana and sub-Saharan Africa is aflatoxin. Now, aflatoxin is obtained when we eat grains that have been contaminated with a fungus. Now this fungus, the way to recognize these contaminated grains, if you find your maize, your beans, your groundnuts, which have not been properly stored, appearing moldy, the fungus produces a toxin, and this toxin on its own can lead to liver damage and cause liver cancer. But when combined with the presence of hepatitis B or C, then the risk for liver cancer increases multiple fold. Non-alcoholic fatty liver disease means the excess fat around your liver, and most people would go for a scan for something, for some other reason, and then it is detected that there's excess fat around the liver. Increasingly, this has been found to be a significant cause of liver disease or significant cause of liver cancer. Now, it's a disease that progresses. So if you do a scan and you find that there's excess fat around your liver, again, there are certain measures that have to be adopted. If that is not done, then it can lead on to progressive liver damage. And again, a final common pathway could be liver cancer. Other less common causes of liver cancer, including obesity and diabetes, are much more common in the Western world. But certainly with the rise in obesity and diabetes, if care is not taken, this would also become major causes of liver cancer in Ghana. Now, hepatitis B, thankfully, is treatable with medicines for a long-term period. Hepatitis C is curable with short-term treatment with medications. We can stop excess alcohol consumption. Be on the lookout not to consume contaminated grains. Do a bit of exercise to lose weight and not lose weight so that you don't develop excess fat around your liver, which can damage the liver. And if you have obesity as well, exercise to lose weight. And if you have diabetes, let your doctor help you control your diabetes very well. Sure, if we can do these, we can in some way prevent the scourge of liver cancer. Thank you.